Okay, good afternoon, everybody. My name is Rebecca Faulkner, and I'm here with my colleague, Olivia Randy. We are presenting about the National Academy for State Health Policy's Behavioral Health Policy Academies. Just a note, I'm sure you all got the message. We are recording this so that for anybody who wasn't able to join us today, they will be able to watch this recording later on from NASHP.org. So what we're going to do today is talk a little bit about NASHP, about why we're talking about behavioral health. Then we're going to talk about our two separate offerings that are running, one for the Behavioral Health Workforce Policy Academy and one for the Children's Behavioral Health Policy Academy. We're going to talk about the application process, our timeline, and then we're going to have time for you all to ask your questions and for us to answer them. So we're going to get started. So just a little bit about NASHP for you all, in case you're not familiar. NASHP is a nonpartisan, nonprofit organization, and we're committed to developing and advancing state health policy innovations and solutions. We like to support state leaders like you by providing technical assistance, publishing research, sharing best practices, and bringing new health policy ideas across the executive and legislative branches of state government. So for our teams, we're focusing on behavioral health. We all know that there's a huge need to address behavioral health needs amongst all ages, and that need has been exacerbated by COVID-19. We know that access is a big problem, and so our states and our health systems have workforce shortages that have misalignment across all kinds of systems, and then that leads to further challenges in designing and implementing quality improvement approaches. So what we're doing about that right now is we're offering two policy academies to support states, one of them for in behavioral health workforce and one of them in children's behavioral health. Olivia.
Thanks. So policy academies are really a staple of NASHP's work, and we've conducted them on a wide variety of topics for a number of years. And really the focus is on bringing together small interagency teams from different states that all work to develop plans and advance strategies around a specific topic. So through the Policy Academy, these interagency teams have the opportunity to receive technical assistance and engage with peers in other states. Next slide, please. So NASHP's Policy Academies provide really a structure for the participating state teams to engage in knowledge sharing and networking with peer states. And then they're also an opportunity for professional development and to build peer support and to learn about and advance innovations and support accountability. Next slide. So NASHP's main role in the Policy Academy is really to support each state team to achieve its goals. And so we do this through supporting peer learning, as well as providing technical assistance from both internal and external subject matter experts that can really help to enhance your team's effectiveness and capacity. And I think I pass it back to you, Rebecca.
Okay, so a little bit more about me and my background, and I know we've got a lot of folks from Texas on the line. I am based out of Austin, Texas, and before coming to NASHP, I was the statewide behavioral health workforce coordinator in Texas. And so I have been thinking about the behavioral health workforce for quite some time. So I invite all of you to join us, NASHP, thinking about how you're going to address your behavioral health workforce issues. The behavioral health workforce issue is a complicated problem, but it leads to limited access to good care for our folks who live in our states. Like I said earlier, we've got limited access, and that we've got misalignment, and we've got a lot of new models that we want to make sure are adequately staffed. Things like CCBHCs and collaborative care that give us a chance to really rethink how we utilize our behavioral health workforce in team-based care, what that looks like in these new models. So NASHP is going to offer a 2-year policy academy where we're going to support up to 5 state teams to develop and implement behavioral health workforce plans. So what can those plans cover? We've got a wide variety of things that can go into addressing your workforce issues. So one of those things can be incorporating the unlicensed skilled workforce into your teams. In a lot of cases in behavioral health care, that means peers, but we're also talking about things like professions like CHWs, or EMTs. So just thinking about the behavioral health workforce in the broadest possible scope. It can also look like developing new workforce types and credentials. For example, Utah is working on a new credential. The Alaska Behavioral Health Aid is another model of just a new way of adding and bolstering the behavioral health workforce. A third thing to think about is administrative and regulatory simplification. Lots of states still have backlogs for applications for folks to get into the pipeline to work. You've got a lot of options there that you can look at and think about. And then finally, how are we going to pay for this? How are we making sure our services are paid for? And, both from maximizing our federal options and what it looks like in the provider realm. So we don't necessarily have to limit ourselves to thinking about these 4 areas. Your state has its own strengths and its own challenges. And part of what we will do in the Academy is put all those puzzle pieces on the table and figure out how they go together for your state. So, who should be involved in your state teams for these academies? For us, we want 5 senior officials who've got decision-making authority. And that can look like your behavioral health agency officials, folks from the governor's office, Medicaid officials. If you've got folks who are really engaged in labor or in the workforce, we would love to have them. Your peer services office, higher ed, career and technical education. We have partnered with the state of Utah, and they have got somebody in their licensure board who's really looking closely at their data. So just thinking creatively about who else you could partner with to think about this problem. Departments of Commerce, for example. And then representatives of the unlicensed skilled workforce, your peer support workforce, CHWs, et cetera. All right, so what is this going to actually look like? So during these 2 years, we will have individual check-in calls with each state on a bi-monthly basis. We'll have quarterly multi-state calls where you'll have peer-to-peer learning opportunities, and then 2 in-person meetings. The first one will be in Nashville in September 25. That'll go along with the NASHP annual conference, and then ongoing technical assistance support. So you've got a fresh problem, give us a call, give us an email, and we will be there to help you sort it out. All right, Olivia.
Thanks, Rebecca. So I'll talk a little bit about the Children's Behavioral Health Policy Academy, and you'll see there are some differences, some similarities to the Behavioral Health Workforce Policy Academy as well. Next slide, please. Thanks. So I'm sure many, if not all of you, are aware that behavioral health needs of children and youth have been rising for over a decade and have really reached unprecedented levels, leading to the national youth behavioral health crisis. And at the same time, roughly half of all children with behavioral health needs don't receive the care that they need. And so without access to these programs and services and supports that they need, the unaddressed needs can really become more significant and require more intensive care. And we also know that there are significant disparities in children's behavioral health needs and their access to care based on a number of factors: race, ethnicity, gender, sexual orientation, and geographic region. And when there are gaps in the continuum of care, youth in crisis might present in emergency departments, which often aren't well equipped to respond and are associated with longer stays and subsequent emergency department visits, higher healthcare costs. And recently, hospitals have really reported an increased number of pediatric mental health related emergency department visits and increased boarding of children and youth with behavioral health needs. So we all know that many states are prioritizing efforts around children's behavioral health, but there are a number of challenges as well in designing and implementing those improvements. So part of our goal is really to support states in this work. So NASHP will be selecting up to 6 state teams to participate in this 2-year policy academy, which is focused on strengthening the continuum of care for children and youth who are at risk of or who have serious behavioral health needs. Next slide, please. So I'll talk a little bit about what states might focus on in this policy academy. So you all will be participating states will be implementing policy changes and strategies to strengthen the children's behavioral health continuum of care. We've outlined a few potential areas that participating states might focus on. These aren't mutually exclusive. States might address other priorities that aren't listed here, but just want to give you kind of a sense of what the scope might look like. So one area is strengthening the array of programs, services, and supports. So States might focus on tailoring their crisis service system to meet the needs of children and youth, or implementing or enhancing intensive care coordination for children and youth. Another area is improving alignment across child serving systems. So that might look like improving or developing an interagency agreement across systems to streamline care. Enhancing screening, assessment, and referral systems. So that might include developing standardized guidelines for assessment. And then the last area we've outlined is supporting the children's behavioral health workforce and infrastructure. So that might include modifying training and certification and licensure requirements, among other topics. So again, these are just examples of what this might look like, to provide you with a sense of the scope of the Policy Academy. These are not mutually exclusive at all, and we expect that and really welcome states that are applying to identify priorities outside of these areas through your application, as well as through the project planning process. Next slide, please. So we are asking for 3 to 5 members from each state team, and similar to what Rebecca described, really looking for folks with decision-making authority. So we ask that each state team include at least 3 members in this Policy Academy that represent the state Medicaid agency, the state behavioral health agency, and the state Title V maternal and child health agency. So that's 3, and then there are 2 optional team members for this Policy Academy. So we included some examples of partners who could be on the team as well on this slide. So we have child welfare, juvenile justice, state education agency, Medicaid managed care plans, and others. And these are just examples again as well. So welcome you to think about others who might be appropriate to add to your team. Yeah, next slide, please. So this is just providing a little bit more detail about the activities for the Children's Behavioral Health Policy Academy. So we'll select up to 6 teams to participate in the 2-year Policy Academy. It'll begin June 2024, last until May 2026. So state teams can expect to participate in at least 2 individual check-in calls per year between your state team and NASHP staff. We will be hosting at least 2 closed webinars that'll support peer-to-peer learning, as well as internal and external expertise will be shared during those events. Each state team can have an in-state visit from NASHP staff to provide technical assistance support, and the timing of that is really based on the state team's interest and availability. Each state team will attend an in-person meeting in September 2025, and that'll coincide with the NASHP conference. And so we'll support travel for up to 2 team members for that event. And then participating states will also be part of a listserv where resources and information can be shared between state teams, and throughout the Policy Academy, we'll provide technical assistance support on an ad hoc basis. Next slide, please. So that's it for the Children's Behavioral Health Policy Academy. I'll talk a little bit about the application process for both Policy Academies. So state teams that are interested in applying for either the Children's Behavioral Health or the Workforce Policy Academies can email either Rebecca or myself to receive the brief application form. And those applications are due to NASHP by 5 o'clock on Friday, April 26th. And then following those applications, we'll be notifying all states that applied in May 2024. So we've listed our contact information on this slide. They're also in the requests for applications that are linked in the webinar description. And you can feel free to reach out if you have questions that come up after this webinar. Feel free to reach out to us with questions as well. And just one other note, we just strongly encourage you to, if you're interested in applying, to also coordinate with colleagues both within and outside of your agencies, and especially for cases where multiple teams from one state might apply to one of the Policy Academies. We'll be sure to kind of make that connection just so you're all coordinated. And I'll pass it to Rebecca.
Okay, so as you can see here, the RFAs have been released. You are in the middle of the informational webinar. And as Olivia said, your applications are due on April 26th. And we will be spending May taking a look at those applications and evaluating them, and we will let states know either, whether or not you've been accepted by the end of May. And we will start having our kickoff calls in June of 2024, and that is when the policy academies will actually begin. Right. Questions? Katie, I see your hand. I am going to just make sure people saw there was a question about whether or not slides will be shared. They will be, and this webinar will be posted. And where will the in-person meeting be held? I'm going to guess that is for Child and Family Health.
So the in-state meeting will coincide with the NASHP conference. So our meeting will be in 2025, so the following year. So I'm not sure if we have the location for that yet, but we'll be sure to share that. If we do have it after the webinar, we can answer. And if we don't have it yet, then we will share it with all teams before the meeting. That'll be in September 2025.
Excellent. Just got a question about what criteria will we use to select states. That's going to vary. One of the things that we are looking at is we are anticipating we will have states who are interested in both of these policy academies. And so that's going to be something that we're going to look at our expertise, the state's needs. And so, it will be really based on your application. And so, Olivia, do you have anything else to add to that?
Yeah, I can just share a couple of pieces that we're looking at and asking for through the application. So we're looking at strong partnerships across agencies, ideally, and none of these are, make or break categories, I would say, but just in an ideal world, what we're looking for: strong partnerships across agencies. Anything that has been established that shows that your state is committed to this issue, or prior initiatives or past work that you've done around either topic, and then looking for your goals to be reasonable to complete, not necessarily completed during the policy academy, but just kind of thinking through what is doable with technical assistance support through this policy academy. So those are just a few areas.
Okay, we've got another question from Diane for Child and Family Health. So can you describe the technical assistance support for the Children's Initiative?
Sure. So I talked about a little bit about some of the activities. So we'll have individual state calls with each state team. And so through those discussions, we'll be able to identify some of the technical assistance that might be appropriate for each state, or technical assistance needs that might come up. So it'll really vary state to state, depending on the focus of the state team's goals and also what the needs are. And then we'll also through the group discussions, through peer-to-peer learning, we'll be able to pull out some of the technical assistance needs from that as well that might apply to all of the different state teams that are involved. But really and as well as through the in-state visits and the in-person meetings. So all of these activities will help to kind of identify different technical assistance needs that might come up. The webinars that we're hosting will focus on technical assistance needs that are sort of across the group and areas that you all might want to learn from a little bit more. And the specific technical assistance support, this isn't the exclusive list, but it'll often be, a call with a subject matter expert or a written resource, or we might be able to, there might be other ways as well that we're able to provide technical assistance. So hope that helps.
Okay, we've got another question, before we move on to that, I do want to say that we will have travel support for our participating states. So for those that, when we have those meetings in Nashville, we're not expecting you to come on your dollar. So just that is something that's important to consider. Another question is there a page or a word count limit? For the workforce application, there is not.
So we have asked for up to 3 pages for the written portion, just to make it hopefully easier on you all as well to not write up too much. That's the goal. But yeah. our commitment.
So Scott, I think that should answer your question about, the time commitment is obviously a cost. And then, you are in charge of implementing whatever we are working on. So that's part of the puzzle, right? Is how are we going to make this happen? Okay. While we're waiting to see if there's any other questions, I do want to say a thank you to, this project is funded by a cooperative agreement through the Health Resources Services Administration. Both our adult behavioral health team and child and family health work on this project. And so this is one of many, many things that we offer through our partnership with HRSA. Any other questions? All right, last chance, Olivia. Anything we didn't cover?
Nothing on my end. Yeah, I think we're all set. Thanks everyone for participating. Really appreciate it. Again, please feel free to reach out to Rebecca or I with any questions that come up later on or while you're applying. Any questions are welcome.
I noticed I got a request for an application while we were speaking, so I'm excited to send that out. All right, thank you all. Have a great day and reach out, stay in touch.
Thank you.